Welcome back to Toledo Clinic TV. My guest is Dr. Moshir Jacob. He's board certified in obesity medicine. And weight loss or being obese is a topic no one likes to talk about. It's very sensitive and personal to people, but it's something that needs to be talked about because being overweight is a huge risk factor for many health problems.
Correct. I mean, if you look at all health systems, all the body organs, you can see that overweight can affect you from the brain, having a stroke, heart attack, diabetes, hypertension, high cholesterol, gallstones, cholecystitis, arthritis, heart failure, left ventricular hypertrophy, sleep apnea. I mean, I can go on and on. You get any organ in your system and you will find that obesity does affect it in one way or another.
So it's very important to maintain a healthy weight, but not always easy to do.
No question about that. It's one of the toughest things in my career. I find it very, very tough and difficult to not only to lose weight, but to maintain the weight loss, which is much, much more tough.
So what are some things that a person can be doing to help along that process?
I mean, it's usually, again, the eating less, exercising more, but we need to pay a little bit more attention to some few other tips, like eating more proteins. Proteins are the main stimulus for our metabolism. And we get this question all the time: my metabolism is low, how can I increase that? It's by protein. So you need to increase your proteins, and this will make an effect. Also, cutting your carbs. So if you go to a low-carb diet, especially for diabetics, this is really makes a big difference. And counting carbs or watching what you eat, focusing on portion control, eating frequently but small meals. This is essential in any weight loss program, that you need to eat multiple times per day, and every time you eat a smaller portion, you gain and be trained about how eating less is good for you. And of course, on top of that, the exercise. You have to exercise to maintain your metabolism, to help to increase this rate of burning calories. So it's the basic concept that everybody knows, but we need to help it a little bit with some tips. And you need to always focus. Everything you eat, every time you have to think about it, this is going to be good for me, how many carbs in it. I mean, you have to, if you are watching what you eat, you need to be attentive to everything you eat every day.
What about water? Intake is very important.
Yeah, water has been known, and every time we hear about it on TVs and all the magazines, water is really helpful. It does increase your metabolism. And if you eat water before you eat, if you drink water before you eat, it's definitely going to improve this weight loss program that you have, because it will help you to eat less. Although there's not enough data or studies to correlate drinking water with strictly weight loss, we don't know the mechanism of that, but it's clearly known, and multiple studies have shown that if you drink water on a regular basis, it's going to help you to lose weight.
Is there a minimum amount that you recommend?
I really don't like to put that, but you just keep a bottle of water with you, and whenever it's empty, just get another one, and always be again attentive to drinking water, especially before you eat. Before you eat, every time drink a big glass of water, and this is going to help you to eat less.
Okay, good advice. Thank you, Dr. Jacob.
You're welcome.
We're back in just a moment.